A myocardial infarction, also known as a heart attack, occurs when the blood flow to the heart is reduced or blocked. A blockage happens when fatty deposits build up in the walls of the arteries supplying blood to the heart, resulting in a poor oxygen supply to the heart muscle. If the blood flow is not restored promptly, the affected heart tissue dies. Typically occurs due to atherosclerosis, plaque rupture, thrombus, spasm of a coronary artery, or platelet aggregation. Oxygen supply to the myocardium is interrupted, leading to ischemia. Ischemia progresses to necrosis if blood supply remains inadequate. Hypertension, dyslipidemia, obesity, nutrition, physical inactivity, smoking, diabetes mellitus, stress. Family history of heart disease, strong family history of cardiovascular disease. Sex, male at greater risk. Age increases with age. Well, let's talk about the clinical manifestations of myocardial infarction. You know, the most common symptom is chest pain or chest discomfort. But it doesn't stop there. Patients often experience dyspnea, fatigue, and a bunch of other symptoms like increased sweating, weakness, nausea, and vomiting. Lightheadedness, palpitations, anxiety, sleeplessness, hypertension or hypotension, and even arrhythmia can occur too. Interestingly, chest pain is often less prominent in women. Instead, they commonly report weakness, fatigue, and dyspnea as their main symptoms. Moving on to diagnosis, there are several key markers we look for. Serum cardiac markers like troponin levels, creatine kinase, and myoglobin are crucial. An ECG can reveal important changes such as T-wave inversion, ST elevation, and the presence of a Q-wave. Lab tests, including a full hemogram and arterial blood gases, are also important. Additionally, an echocardiogram and radionuclide imaging can provide vital information. Clinically, we look for features like pain, indigestion, apprehension, shock, and sometimes a low-grade fever. Now let's discuss the non-pharmacological management of myocardial infarction. First and foremost, counseling and education of patients are essential. Managing stress is another critical aspect. Patients should be advised to quit smoking and avoid alcohol intake. Diet and nutrition play a significant role, so salt restriction and aiming for a healthy weight are key strategies. Thrombolytic agents, anticoagulants, and antiplatelet agents are often used in the management of myocardial infarction. Antihypertensive agents, lipid-lowering drugs, and vasodilators also play a crucial role. Additionally, there are other medications like analgesics, anti-ulcer drugs, and antidepressants that can be part of the treatment plan. Percutaneous transluminal coronary angioplasty, also known as PTCA, stent placement, atherectomy, coronary artery bypass graft, commonly referred to as KBG. Avoid alcohol use, control high blood pressure and high cholesterol, diabetes control, eating a healthy diet, regular exercise, enough sleep, manage stress. Arrhythmia, cardiogenic shock, which occurs in 10% of cases. Congestive heart failure, thromboembolism, rupture, seen in 5% of cases, cardiac aneurysm, also in 5% of cases, pericarditis. Thank you all for watching this video. We truly appreciate your time and dedication as you prepare for your NCLEX journey. Remember, success comes with the right guidance and preparation, and we're here to support you every step of the way. If you're looking for expert coaching, whether online or live, visit www.brispainternational.com to register for top quality NCLEX coaching. You'll also find valuable IELTS guidance to help you reach your goals. Stay focused, keep pushing forward, and believe in yourself. You've got this. Here are some NCLEX style questions to test your understanding of myocardial infarction. Question 1. A patient presents with chest pain, dyspnea and diaphoresis. Which of the following is the priority nursing intervention? A. Administer oxygen. B. Obtain an ECG. C. Administer nitroglycerin. D. Assess pain level rationale. Administering oxygen is the priority to ensure adequate oxygenation of the myocardium. Question 2. Which of the following is a modifiable risk factor for myocardial infarction? A. Age. B. Family history. C. Hypertension. D. Gender rationale. Hypertension is a modifiable risk factor that can be managed to reduce the risk of myocardial infarction. Question 3. What is the most common symptom of myocardial infarction? A. Dyspnea. B. Chest pain. C. Nausea. D. Fatigue rationale. Chest pain is the most common symptom of myocardial infarction. Question 4. Which diagnostic test is most specific for myocardial infarction? A. ECG. B. Troponin levels. C. Chest X-ray. D. Echocardiogram. Rationale. Troponin levels are the most specific marker for myocardial infarction. Question 5. Which of the following medications is used to dissolve a thrombus in myocardial infarction? A. Beta blockers. B. Thrombolytic agents. C. Antiplatelet agents. D. ACE inhibitors. Rationale. Thrombolytic agents are used to dissolve thrombi in the treatment of myocardial infarction. Thank you for participating. Make sure to review these questions and answers to solidify your understanding. Keep practicing and you'll be well prepared for your NCLEX exam.